Anxiety is something that we all experience, and it's good because it's our warning system, a bit like a car alarm. But just like a car alarm becomes less useful if it goes off every single time somebody walks past it or every time the wind blows, if our anxiety system becomes a bit too sensitive and we start feeling lots of fear and worry in lots of different situations, that might be an indication that we might need to seek a bit of help. In your child, you might notice them being more clingy than usual, or more irritable, or maybe they're saying they don't want to go to school. You might notice your child complaining a lot more of headaches or stomachache, or just generally not wanting to engage in the activities that they used to enjoy. A parent should seek more immediate help if they notice that their child is becoming particularly withdrawn, say going to their bedroom and not wanting to come out, if their anxiety symptoms start deteriorating quickly and you become particularly worried, if you notice that they are self-harming or they're expressing kind of thoughts about suicide, or if they're having flashbacks about a previous traumatic event, those might be reasons why you want to seek help more urgently. And to do that, you should arrange an emergency appointment with your GP, or you can call 111. And if you're immediately concerned about their safety or the safety of somebody else, you should call 999, or you should go to your nearest emergency department, where they will have trained mental health professionals there who can help. We're going to talk now about some ways that you as a parent might be able to help your child manage their anxiety. And the first point we're going to talk about is helping your child to get the worries out of their head and down onto paper. If they don't feel able to write it down themselves, they can share it with you and you can write down what their worries are. To do this, you really need to try and get your child to talk about what's causing them anxiety and what the worries are in their head. You might be able to track this over the week, writing down the themes of some of the things that are worrying them. And then you can share this with a professional when you do get an appointment with them. Helping your child to get the worries out of their head, it helps put it into perspectives and actually cools down some of their emotional temperature and can actually reduce some of their worries. Our second tip is identifying vicious cycles of worry and then how to challenge those thoughts. As psychologists, we talk a lot about vicious cycles. Now, a vicious cycle is when we have often a negative thought that then causes us to have a particular feeling, in this case maybe anxiety or worry, which comes with some physical sensations, like maybe our heart starts beating faster, or we feel sweaty, or we feel clammy. And because of that, we might then be tempted to do something, for example, leave a situation, or maybe we'll get irritable, or maybe we'll shout. And the more we do that, the more we have the anxious thought and the more we feel anxious. So once you've identified a vicious cycle, say for example around going to school, is there a more balanced and realistic way you as a parent can help your child see their thoughts? One important thing to remember when thought challenging is to encourage your child to come up with their own balanced or alternative way of looking at the situation, rather than you going in as a parent and offering a different situation, because your child might find that quite invalidating to the things that they're worrying about. The third tip that we're going to be talking about is addressing the avoidant behaviour that's quite common with anxiety. It's really common for everyone, children and adults, when they're feeling anxious to want to escape the thing that's causing them anxiety, and that escape we call avoidance. The main way to address avoidance at this stage is to notice the situations where your child is avoiding things, when the anxiety is telling them they can't do something, and writing them down and keeping a note of them at the moment, so that when you do go to see a health professional, you've got some live examples that you can take for them. To help you and your child manage their anxious feelings, we often talk about relaxation techniques. One good relaxation technique is physical exercise. So encouraging your child to move or to do something physical has been shown to really reduce feelings of anxiety. The second method of relaxation is calm breathing. So we encourage the children to breathe in through their nose, imagining that they are inflating a balloon in their stomach. And they breathe in for 6 or 7 seconds, pausing at the top, and then breathing out again for 6 or 7 seconds, imagining that they're deflating that balloon in their stomach. And if they do this for 2 or 3 minutes, it's been shown to really reduce levels of anxiety. The more you can educate yourself as a parent, the better. There's websites out there, there's charity websites, there's apps, and there's websites for all ages. So I really would encourage you to go and look for some of these. We know that looking after a child with anxiety can be both physically and emotionally draining for you as a parent. And so it's really important that you look after yourself. There's lots of websites and charities out there that can talk about supporting parents and carers. So we would really encourage you to use those.